And welcome to this community briefing on our ongoing pandemic response. Providing interpretation for us today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us again today. Our local situation is showing significant improvement. We're seeing a continuous drop in cases, and now we're also seeing a drop in hospitalizations. For the first time since the Omicron surge started in late December, our cases have dropped below 1,000 a week. And for the first time since November, our hospitals have reported fewer than 100 patients hospitalized with COVID-19 for a few days in a row. These are strong signs that our community is coming through this surge and COVID-19 is moving closer to the level that is more manageable. So let's take a look at the data. After peaking at nearly 5,000 cases the week ending January 15th, we've seen the number of cases dip 4 straight weeks, as noted on this chart. We had 809 cases last week, and this 4-week decline in cases represents a drop of more than 80%. We hope this downward trend will continue. Unfortunately, our positivity rate is holding around 16%. We would like to see that positivity rate drop below 10%, which would reflect less transmission of the virus. Last week, we shared that our main concern continued to be the number of people hospitalized with COVID-19 and the number of deaths. We're encouraged to report that hospitalizations have decreased significantly. As you can see on this chart, since February 1st, we've seen a 47% drop in the number of people hospitalized. And starting February 11th, our hospitals have reported less than 100 COVID-19 patients each day. Today, the hospitals are reporting 78 patients, with 54 from Lancaster County. While patient count is still high, our hospitals are finally starting to feel less strained from caring for so many patients with COVID-19. And again, sadly, today we are reporting 1 death, a woman in her 60s. We've lost 17 members of our community to COVID-19 so far in February. The health department also pays close attention to other data that help to provide a broader view of the pandemic locally and to corroborate what we're seeing in our key indicators. One set of data is from Lincoln Public Schools. Its public dashboard includes positive test results for both staff and students. And on this chart, you can see the bars in blue are the county's total weekly cases. The LPS case counts are represented by the black line. As you can see, LPS data is tracked very closely with the total cases in our entire community. Reports we're hearing from the other schools in Lincoln and Lancaster County also reflect this drop in cases. You may remember we touched on wastewater testing for virus particles as at one of our briefings earlier in the pandemic. This is another data set we've kept an eye on. Our partners at the Lincoln Transportation and Utilities wastewater system have been sampling wastewater and having it analyzed for COVID virus particles. The chart you're looking at shows the total weekly case counts, once again in blue, and the gray-green line is the virus particles in the sewage. As you can see, this data has also tracked very closely with our human case data. We have representatives from both LTU and the health department here today who can answer any questions media may have about this type of testing. What all of our indicators and additional data are telling us is clear. The spread of the Omicron virus is quickly dissipating in Lincoln and Lancaster County, and its impacts in terms of cases and hospitalizations are getting closer to the sustained improvement that we all want to see, but we're just not quite there yet. After 6 weeks in the red on our COVID risk dial, the progress we have made has lowered the risk level to elevated orange this week. Please keep in mind that orange means the risk of transmission of COVID-19 in our community remains high, and that precautions are still necessary to prevent the spread of the disease. For now, the mask requirement is still in effect, and we continue to recommend that residents avoid crowded situations, Get tested if you have cold, flu, or COVID symptoms. Stay home if you're sick. Watch your distance and wash your hands regularly. And we strongly recommend that every person get vaccinated or boosted when eligible. We're no longer recommending that you stay home. You can find the guidance for Orange posted on the covid19.lincoln.ne.gov website. The number of cases generally impacts our hospitals about 2 weeks later, so we anticipate the number of people hospitalized with COVID-19 will continue to drop, providing welcome relief to our hospitals. As we have been throughout the pandemic, we evaluate our local situation daily and watch hospitalization data very closely. As we shared last week, the goal is not to have the directed health measure any longer than we need it. We provide a vaccination update every week because getting vaccinated and a booster dose is the best way to protect yourself and those you love, to prevent severe illness, and to save lives. Today, 66% of all Lancaster County residents are fully vaccinated, and around 60% of residents ages 12 and up have now received a booster or third dose. Our local data shows that more than 90% of the people hospitalized in January with breakthrough COVID-19 infections were eligible for a booster dose, but hadn't received it yet. If you're eligible for a booster dose, it's important to get it as soon as possible to have the benefit of that added protection. We continue to work with partners to host our convenient walk-in vaccination clinics at several local elementary schools and other locations close to home. All clinics offer first and second doses as well as boosters. So here's a quick rundown of our upcoming clinics. Tomorrow we'll also be at Freedstone Elementary School from 3:15 to 6, and we'll have another afternoon-evening clinic at the Health Department from 4 to 7. On Thursday afternoon, we're hosting a clinic at Norwood Park Elementary from 4 to 6:30. We also have another clinic at the Health Department this Friday from 9 to 3. So for more clinic times and locations, go to covid19.lincoln.ne.gov or call us at 402-441-4200. I also want to provide a quick update about vaccine approval for children under 5. Last Friday, the Food and Drug Administration announced that it was postponing its advisory committee meeting about the authorization of the Pfizer vaccine for children 6 months to 4 years old. In a statement, the agency said the postponement would allow more time to review and evaluate additional data from an ongoing clinical trial. A new date for the meeting has not been set yet, and we will continue to monitor this closely and report to you. And now turning to testing, with many at-home testing options, we've launched a new resource that gives Lancaster County residents the option of reporting results of their at-home tests to the Health Department. It's a simple online form available on the COVID-19 website. And joining us today to walk you through this new resource is Tommy George, one of our public health epidemiologists. Tommy?
Thank you, Director Lopez. The Lincoln-Lancaster County Health Department is pleased to announce the availability of an online form for reporting your home test kit results at covid19.lincoln.ne.gov. In the form, the Health Department will gather details about home test kit reporting that will help us continue to respond to the COVID-19 pandemic. This particular form should only be used by Lancaster County residents who are completing a test kit at home. For tests completed at your school, in your child care, in a healthcare facility, some other testing site, or those proctored by eMed, you do not need to use this form. All information reported through this form will be kept confidential. So let's take a quick run through. After going to the covid19.lincoln.ne.gov website, you'll need to scroll down to the COVID-19 testing section. The section we're looking for is directly below the wrist dial image. At the bottom of this section is a link that says COVID-19 Home Test Reporting. You'll need to click on this link. After you click on the COVID-19 home test reporting link, you'll see a description of the form and the beginning of the data you'll need to enter. You'll start with information about the person tested. After the patient information section is the testing information section. This section has important information about the type of test used, when the test was done, and the test result. After filling out the form, click the Submit button to send your results to the Lincoln Lancaster County Health Department. Once you complete the form, you'll be redirected to helpful quarantine and isolation resources on the COVID-19 website. If you require assistance in completing the form, please call 402-441-8006 and a health department nurse will assist you. Reporting these results will help enhance the health department's level of understanding for how much home test kits are being used, as well as how much COVID-19 may be spreading in the community that otherwise would not have been reported. Thank you.
Thank you, Tommy. It's important to mention that the results coming in through the home test reporting form will not be reflected on the dashboard. However, reporting home testing results allows us to direct people to helpful information about quarantine and isolation, as Tommy mentioned. It also provides additional information about what's happening in our community. Our numbers continue to head in the right direction, and we're encouraged by our progress. Our risk dial has moved to orange, and you can find updated guidance, as I mentioned, at covid19.lincoln.ne.gov. We anticipate the number of patients hospitalized with COVID-19 will continue to drop, providing welcome relief to our hospitals. It is important that we continue preventative measures right now so we don't lose the ground that we've gained. We're evaluating our local situation daily, as I said, and watching hospitalization data very closely. Again, the goal is not to have the directed health measure any longer than needed. And with that, we're happy to take any questions.
Hi Pat, it's Matt Olberding with the Journal Star.
Hi, Matt.
So assuming that the trend continues and we continue to see cases dropping, hospitalizations dropping, in that scenario, can you see any reason why the mask mandate wouldn't expire when it's scheduled to on the 25th?
I can't see any reason that it wouldn't expire.
Okay. All right, thanks.
This is Bailey. Shop with 1011. I was wondering if the health department has seen any additional cases of the BA2, the subset variant of Omicron.
We haven't, Bailey, which we're very happy about.
This is Bailey. And just what are you hearing from hospitals? You said things are starting to ease up a little bit for them. Just what have they described?
Well, I think, it's welcome relief to the strain that's been on the staff, and it's allowing them to admit people and to possibly look at beginning to perform some of those surgeries that people have been postponing. And I think the hospitals have said before, sometimes they're titled elective surgeries, but they're really not necessarily elective surgeries in the true sense that we think of. So a lot of patients will be able to get in now and get those procedures done, some of which have worsened during this waiting period of time. But I think definitely the intensity of the level of care that needs to be provided to so many patients, that lessening allows the staff a little bit of a breathing space and allows them to be sure that when we have emergency situations coming in, that we're able to take care of the people who live in our community that might be having a heart condition or be in an accident or have other types of needs going on. So that even in and of itself is a tremendous relief to our healthcare providers.
voluntary 4-week lockdown that you asked people to do you think that is what helped us get to this point, or do you think the virus just kind of has run its course, the Omicron variant ran its course?
I think we watched what was happening nationally, and I do want to say one thing. We didn't ask for a lockdown. We didn't impose a lockdown. We were just asking people to stay at home unless they had to go to work, school, or out for food or medical care. I think that it did make a difference in helping the strain on our hospitals so that we could care for those people who really needed that level of care and prevent others from going in. We saw a lot of people complying with the mask mandate. I think we had our highest number of cases ever during this time period, but we're seeing, so grateful to see that we're declining like we've seen in other states like New York and New Jersey in periods that were ahead of us in the Omicron spread. And definitely I do believe it has helped us.
So one last question. Why, when people report a home test, will it not be reflected in the dashboard? How will you use it if it's not factored in with other cases?
The reason is we don't actually get a report. It's just a verbal report, and everything we have in the dashboard is an actual verified report that's sent to us. The new eMed tests that are going to be coming soon to our community that were purchased by the Department of Health and Human Services will have an option for somebody to access to a medical professional that can guide the testing, and those results then will be sent in to the department for account in our testing data. But that's because of the way they're recorded and monitored and the data is sent. And as well, those individuals that do their testing that way with that home test will have a verified test that they can use for travel or going to work or other places. Okay, well, thank you again for joining us today. Remember to get vaccinated, get your booster, and wear a mask. Thank you.